Thank you for joining today's educational webinar with Cancer Support Community Los Angeles. I'm Abby Espinoza, the Program Manager at CSCLA, and I'm honored to welcome you to this week's webinar titled Integrative Oncology, an Evidence-Based Approach for Patients with Cancer. Before we begin, if this is your first time joining us, Cancer Support Community Los Angeles is a premier nonprofit organization providing vital social and emotional support to families facing cancer, including patients, caregivers, and their loved ones, all at no cost. Our programs include support groups, healthy lifestyle classes, social activities, and educational programs such as this one. If you would like to learn more about our services or watch past webinars, please visit our website at cancersupportla.org. Before I introduce today's speaker, please note that your video and microphone are automatically disabled for this webinar. Please enter questions for the speaker into the Q&A feature found at the bottom of the Zoom window. Questions will be answered at the end of the presentation. We may not be able to get to all your questions today, but we will get to as many as possible. Please use the chat feature to share comments and resources with other participants or to ask questions of CSCLA. We ask you to limit chat comments to information relevant to this topic. Dr. Richard Lee is a professor in the Department of Supportive Care Medicine and Medical Oncology at City of Hope National Medical Center. Dr. Lee serves as the inaugural director and endowed chair of the Cherng Family Center for Integrative Oncology and oversees this national program that involves clinical, research, and educational programs. As a medical oncologist, he provides routine oncologic care with a focus on gastrointestinal cancers. Additionally, he provides broad consultative services regarding supportive and integrative cancer approaches. Currently, Dr. Lee is building integrative oncology services at the City of Hope for the entire enterprise. His research includes health services research utilizing survey studies, exploring both patients' and clinicians' perspectives about supportive and integrative services. It gives me great pleasure to welcome today's speaker, Dr. Lee.
Hi, good afternoon. Thank you, Abby, as well as Segal and the rest of the Cancer Support Committee of LA. Thanks for inviting me. I'm going to be sharing my screen here in a second, and hopefully you'll be able to see it. Okay. Hopefully, are you able to see and hear me okay?
Yes, that looks good, Dr. Lee.
Great. Well, good afternoon. Again, it's my pleasure to be here with all of you, and happy to share about this new area of integrative oncology. And so I'll be talking about an evidence-based approach for patients with cancer. I have no financial or conflicts of interest, financial relationships. So our outline will be talking about what is integrative medicine, why does it matter to you as a patient. We'll talk about ICAM or integrative complementary alternative medicine, really as it relates to oncology or in the cancer realm. And then we'll talk about what is an evidence-based approach. We'll cover topics like herbs and supplements, which is the most common question I get in my own clinic. And then we'll talk about general health as well as managing specific symptoms such as pain, stress, and sleep. So when I hear patients talk about integrative oncology or integrative medicine, I get a lot of books, I get a lot of articles. My colleagues often give me a funny look about what do I do exactly when they hear me say I focus on integrative oncology. And I like this cartoon here where it says, Frank started to get a funny feeling that his doctor was a quack. Unfortunately, in the field of integrative oncology, there's a lot of variation in terms of what's happening and what's being provided, and a lot of variation in terms of the level of evidence. And so we'll talk about how do we filter out really fact from fiction, what's really based on good science and evidence versus what might be more marketing. And unfortunately, there's a lot of marketing out there. So when we talk about integrative and complementary alternative medicine, really there's these terms are sometimes used interchangeably, but we have to think about them very carefully. And when we think about alternative, we're thinking about a modality that might be used in place of conventional modern medicine. So an example would be, I've had patients who say, well, I'm going to cure myself of cancer with acupuncture. and I would call that alternative. And then some patients will say, I'm going to use acupuncture to treat my cancer as well as use radiation, chemotherapy, or surgery. And so I would consider that more of a complementary. What we really want to move toward is an integrative approach, which is utilizing both conventional therapies, conventional medicines, in a coordinated manner as personalized evidence-based together with integrative approaches. So we want to use them in a very deliberate way that brings the best of both worlds. Now, if you look at ICAM, or Integrative and Complementary Alternative Medicine, it is one of the institutes at NIH, and it started as the Office of Alternative Medicine in 1991, was then renamed as Complementary Alternative Medicine, National Center for Complementary Alternative Medicine. Now we call it the National Center for Complementary and Integrative Health. And what you can see is that we're really moving away from the term alternative and moving toward complementary, more integrative approaches. And they define it as a healthcare approaches developed outside of mainstream Western or conventional medicine. So it's a very broad category. And our hope is that things that are now considered maybe more complementary or integrative might become more standard of care later on. This comes from the NCCIH website in terms of what are the different categories of things that are being evaluated. You have natural products, which includes herbs and supplements, mind-body practices like meditation and breathing techniques. We have more physical-based therapies like acupuncture or massage. So there's a variety of different integrative approaches that exist. One definition I like, what is integrative medicine? I think about it as a field that reaffirms the patient-practitioner relationship, focuses on the whole person, should be informed by evidence, and makes use of all appropriate therapeutic approaches, providers, disciplines to achieve optimal health and healing. And so I think what's important is it has to be evidence-based. There has to be at least some science, and it has to be appropriate for every individual patient. So not every therapy is appropriate and should be utilized by every patient. So we think about in the realm of cancer, what does that look like? And so we have the cancer that we're treating, and we have all these great therapies that are provided from surgery to chemotherapy, immunotherapy, stem cell transplant. But we also want to support the patient with supportive care therapies like we have things like palliative care, nutrition, rehab, exercise. We also want to support the mind-body connection. We have psychiatry, psychology, chaplaincy, and we want to support the patient themselves, their families with navigators, support groups, social work. And integrative medicine is another kind of piece of the puzzle for us to really help patients that can help reduce symptoms and help improve their quality of life, reduce side effects from treatment, as well as potentially make some of the treatments better. And we know that interventions like exercise can actually prolong survival in patients. So we want to bring these evidence-based approaches like acupuncture, meditation, massage, use of natural products when appropriate, and then think about lifestyle and music and art therapy and other modalities. Here at City of Hope in the Cherng Family Center for Integrative Oncology, this is our clinical model with the patient in the middle, the family, the culture they bring together. We utilize the best of modern medicine, and then we want to surround them and support them with all the right services to get them through the whole journey. And what I've highlighted in red are some of those things that are really focused in the area of integrative oncology, like nutrition, exercise, integrative medicine consultation, acupuncture, massage, music art therapy, yoga, meditation, group programs, and healing spaces. Now, if you think about ICAM use in the United States, in the past, say, 12 months by adults, you can see natural products are very commonly utilized. So these are herbs and supplements. Relaxation techniques are also pretty common, 1 in 10. We have things like meditation, special diets, and acupuncture. So when we talk about integrative oncology, or what is an evidence-based integrative oncology approach, we really help patients think about a holistic, comprehensive approach that focuses on their health and wellness. We want to think about treatment options. So we educate them, we do research. And so in terms of herbs and supplements, what's appropriate, and then we have to think about what's safe. We want to prevent any kind of drug-drug interactions or other side effects. And there are non-pharmacologic or non-herb supplement drugs that we can use instead of these products like acupuncture, meditation. Can we manage chronic symptoms such as pain with the use of integrative therapies like acupuncture, massage? And then for patients seeking alternative therapies, really provide some balanced guidance about the risks and benefits and monitor them for safety and outcomes. So the number one question I get from patients is about the use of herbs and supplements. And I'll just note here that in this Consumer Reports, this is actually over 10 years old, but there's growing data that the use of herbs and supplements has their own dangers. And so a lot of patients assume that they're safe. one of the studies I like to talk to patients about is the fact that many of our medicines are derived from natural herbs or plants. And many of you may have heard of the Dana-Farber Cancer Institute. This is the Harvard Cancer Institute. And it's actually named after a gentleman named Sidney Farber, who you see here as the first author of this paper from 1948. He's considered very famous because he developed one of the first chemotherapies to put cancer into remission, in this case, pediatric leukemia. But if you look at this article from 1948, he developed a drug that blocks folate metabolism. And in this case, it's called aminopterin. And the reason he discovered this was that he actually gave his kids folate supplementation because he thought the folate might be helpful for the patients because they were malnourished and or anemic. But what he actually discovered was giving folate, which everybody needs in their diet. But if you give high doses of folate to a patient with leukemia, it actually caused the leukemia to grow faster. And so he made this observation, and then he realized, well, if folate supplementation makes it worse, what if I used a drug that blocked folate metabolism, which is the drug he developed, and it put it into remission? And of note, we still use anti-folate drugs today. We still use things like methotrexate. We also use pemetrexed in lung cancer. So this concept is still useful for treatment of today. Now, there have been other studies that have shown that oversupplementation might be dangerous. This is an example of a large randomized trial to prevent lung cancer using beta-carotene vitamin E. What they noticed was that patients who were randomized to beta-carotene compared to placebo, actually the beta-carotene caused more lung cancers and caused a higher rate of death as compared to taking placebo. Here's another study called the SELECT trial, where they used vitamin E to prevent, or with the hope of preventing prostate cancer. And both these studies had thousands of patients. In this study, what they found at the interim analysis was that the vitamin E arm had more prostate cancer than the placebo pill. So very similar. It did not help. It actually seemed to cause more harm. And there have been other documented risks. A lot of times I have patients who ask about apricot seeds, which is essentially cyanide, so it can cause cyanide poisoning. Certain herbs like SEACT can actually stimulate the growth of breast cancer cells. And you can see here some of these things like green tea can cause liver toxicity and cause, if they're adulterated and they're not purified, they may contain lead. And so there have been examples of Ayurvedic herbal medicine and Chinese medicine leading to lead poisoning because they weren't monitored for quality. And some of these natural products can actually cause drug-drug interactions or interactions with your ongoing treatment. So just some examples. We'll talk about beta-carotene during radiation in a minute. St. John's wort can interfere with certain types of chemotherapy as green tea. And then things like ginger, garlic can actually increase your risk for bleeding and interfere with certain types of chemotherapy. And so you have to be very cautious about the use of these types of herbs and supplements because the dosing is variable, the quality, safety, oftentimes you don't know the mechanism of action as compared to prescription medicines where there's a lot more known. Now, one of the things to note is that patients often ask, well, maybe this will help reduce the side effects during treatment. And so they actually did a study of beta-carotene during radiation treatment for head and neck cancer. And it did reduce the symptoms caused by the radiation. So yes, it did reduce symptoms, side effects from the therapy. However, when they look at the 5 to 10-year survival, what they noticed was that the placebo arm had better survival than those who received antioxidants during treatment, in this case, beta-carotene. So the feeling is that the reason that they had higher recurrence rates and higher rates of death is because the antioxidants interfered with the radiation's effectiveness. So they had higher rates of their cancer recurring. And thus, although it reduced the side effects, it was because they made the radiation less effective. So in this case, it unfortunately caused an interaction. And there have been other studies. More recently, you can see this study from 2019 where they looked at supplement use in patients with breast cancer. And what they noted was that in the YY indicates patients who are using B12 both before and during treatment and iron. And you can see that patients who are using B12 or iron tended to have worse survival than those patients who did not. And in particular, these are patients who did not necessarily have B12 or iron deficiency. So again, just taking more of something does not always necessarily mean it'll be better for you. And you can see here, there's a study here looking at calcium intake. And you can see here rates of mortality increase, and specifically cancer mortality increase among patients who are taking high doses of calcium. And so I think the key takeaway point here is too much of a good thing could be harmful. And so you want to make sure to check your levels, like your vitamin D. You can check your calcium intake, or do you really need B12? Check your level before taking extra supplements, because if your level is normal or high, just taking more could actually be more harmful than beneficial. And then we mentioned earlier about quality. Unfortunately, most supplements over the counter are not quality controlled, by the FDA or other agencies, and so you don't really know what's in the product. This is a study where they're looking at ginseng extracts, and they tested how much ginseng was actually in the product versus what was on the label. And what you can see here is that some products had much less than what was on the label. So the top one you can see, it says 44% of what was on the label, but some might actually have more than what's on the label. So you can see one says 261, it has over 200% of what was actually listed on the label. And then if you look at the dose, all the companies had different doses. So some companies, told you to take 10 milligrams. Some companies were recommending up to 72 milligrams. So the dose is quite variable, and so you do have to be cautious. So I always recommend my patients, if you are going to take a supplement, one, talk to your medical team and make sure it's appropriate and safe. Check levels when appropriate. If you're not iron deficient, don't take iron. But if you are iron deficient, then you probably do need extra iron. And then if you're going to take a supplement, make sure it's been third-party verified. So look for one of these labels like NSF, USP, or Consumer Labs. These are companies that do supplement quality testing. So, a company will pay them to say, can you double check my product to make sure it's clean and it has the right levels? So make sure it's always been third-party, quality checked with any supplement you're taking. Okay, now we have a little Q&A here. We're going to shift gears. Let's talk about some herbs and supplements for which they have been studied and might be helpful. So I don't know if anybody might take a guess, just think in your mind what this might be. And if you guess ginger, you are correct. That was a ginger root. So ginger actually has been studied in patients with cancer to reduce nausea and vomiting. And what you can see here is they compared to placebo, which is the black bar there, 500 milligrams and 1,000 milligrams as compared to 1.5 grams was better at reducing nausea symptoms. So again, more is not always better. And in this case, probably 500 milligrams was the most effective in reducing nausea symptoms due to chemotherapy. So if patients have nausea, especially if it's mild and they don't want to take a medicine, they could try some ginger tea or even try some ginger supplementation at 500 milligrams. Here's another plant. Let's see if anybody's able to guess what this might be. This is a root, a ginseng root. So ginseng has actually been studied as a way to help with cancer-related fatigue. And so ginseng extracts in this study was shown to improve energy levels. And so again, fatigue is very common among patients with cancer. And so you might want to think about just a ginseng tea in the morning or afternoon to kind of give you some extra energy. Of course, don't take it at night because it will keep you up at night. In this study, I think they used 2,000 milligrams a day if you wanted to use a supplement, but always recommend starting with a simple tea first. Again, checking with your medical team. Anybody might want to take a guess what this is, what plant this is. Has a great gentle smell. It's lavender. And so lavender essential oils, so just smelling lavender oil has been shown to reduce anxiety. And you can see in this study where patients are getting needle insertion just by smelling the lavender, they had less stress and less pain. And I can tell you, we are doing studies on lavender aromatherapy during bone marrow biopsy and during chemotherapy, and we do see similar benefits. So we have some of those studies ongoing. All right, last herb here. Anybody want to take a guess? Here in California, you might actually come across this plant. It's the cannabis plant. So people are studying the potential benefits of medicinal cannabis. There's two main ingredients, THC and CBD, delta-9 tetrahydrocannabinol and cannabidiol, as well as other compounds. Actually, cannabis has been used for thousands of years. And actually, they found this grave, a shaman grave in the Gobi Desert, and the grave contained 2 pounds of cannabis. So they were cultivating this over almost 3,000 years ago. Now, there's some variation in terms of national guidelines. So National Academy of Sciences indicates that there are some reasonable data supported use for things like pain and nausea and anxiety. NCCN guidelines, which is the National Comprehensive Cancer Network, also does recommend it for sleep and nausea. ASCO, American Society for Clinical Oncology, thinks there's at least some data for nausea, some unclear data for the other ones. And unfortunately, the MASC, Multinational Association for Supportive Care in Cancer, at least their review felt like there wasn't any compelling data yet in terms of cannabis use. So there is some variety, but what I would say is there are some reasonable clinical trials demonstrating the benefits of cannabis. So this is a more recent one, 2024. 147 patients were randomized to a THC CBD, a 1-to-1 ratio. And what they found was that a quarter of patients had complete response, meaning no nausea or vomiting, as compared to 8%. And so what you'll see here, you can see the sample size. The third one, the 147, is the study I just mentioned. And then they started to look at other studies of cannabis and other studies of anti-nausea medications. And what you can see, the response rates compared to the cannabis and placebo. Now, placebo, you can see some people still respond to placebo, anywhere from 8% up to 64%. But comparing the medical cannabis, you can see that absolute difference is about 16%, which is very close to other modern prescriptions like olanzapine and apripitant, what we often prescribe for nausea. So what you can see here is that there's an absolute difference of 16% in the study we just talked about, and which is equivalent to other studies, and the relative improvement is 3.0, which is quite high. So I think there's some reasonable data there. Now, not every study of cannabis has been positive. This is a study from Australia looking at overall quality of life, and they did not find any real difference in patients with advanced cancer really close to the end of life. It does, medical cannabis then have some side effects, and sometimes the side effects may outweigh the benefits. And so what I recommend to patients is that you could consider, there is actually an FDA-approved drug called dronabinol, which is approved for nausea, vomiting, and for poor appetite, anorexia. Here in California, you do have medical cannabis dispensaries, so you could think about it for nausea and anorexia with THC, which is what dronabinol is synthesized THC. For 1-to-1, I think you can think about it for cancer pain or for nausea. We just saw that. And CBD, there might be some data to help with anxiety and sleep. Now, do be cautious. THC does have cognitive effects, and so some people might feel euphoric or high on that, so you want to start a low dose. And then CBD in particular, you don't want to go higher than 300 milligrams a day, as it can cause hepatic dysfunction at higher doses, so be careful. Again, always talk to your medical team before using any of these things. So here, let's talk about some of the basics around integrative medicine is really around nutrition and physical activity. Oftentimes, there's nothing can beat a good, healthy meal and exercise. And remember, the American Institute of Cancer Research notes that approximately 1/3 of all cancers could probably be prevented if we all followed the guidelines on eating healthier, exercising regularly, and keeping fit. So American Cancer Society guidelines talks about, again, very similarly, about being fit overall, exercising regularly, having lots of fruits and vegetables, limiting processed foods like meat, red meats, or refined grains, and limiting alcohol are all recommended. And that's the same from the American Institute of Cancer Research. You can see their guidelines are along the same lines. As well as in the lower right-hand corner, it does say, do not use supplements for cancer prevention. As we noted, there have been supplement studies for cancer prevention, and all those studies were either negative or potentially shown to harm. So that's why they do not recommend it based on the data to date. So lastly, I just want to talk about what are some integrative approaches to help with symptoms. So now, who doesn't have occasional back pain, right? And what happens when you get back pain? Pain can cause you to be more stressed. And when you're stressed, oftentimes you have trouble sleeping at night. And if you have trouble sleeping at night, it just seems to make the pain even worse, right? So these symptoms can all be related and make a kind of cycle on each other to making it worse. So what can we do in a way that doesn't depend on another prescription to help with things like pain? The Society for Integrative Oncology and ASCO, American Society for Clinical Oncology, have put out joint guidelines on evidence-based approaches to pain management in patients with cancer. And what you can see here, there's a variety of different types of therapies that have been studied in clinical trials showing benefit. You can see the first column has the I there. That's for intermediate versus low. And then strength of the recommendations, moderate or weak. And you can see here, acupuncture is commonly listed as a way to help manage different types of pain. So you can see here that there have been multiple studies looking at acupuncture, not only for pain, but for nausea, anxiety. There's also dry mouth, hot flashes, and other symptoms that acupuncture might be helpful for. Here's one of the randomized controlled trials published in JAMA Oncology. Patients were randomized to ear acupuncture versus electrical acupuncture versus usual care. And you can see significant decreases in pain among those who received ear acupuncture and electrical acupuncture. This is a study from Dr. Jun Mao at Memorial Sloan Kettering. This is another study of just ear acupuncture for pain. And you can see there were two placebo groups. And really, only the group that received real acupuncture had decreases in pain at 30 and 60 days compared to basically fake acupuncture. Also, you see data that supports the use of things like massage and reflexology, which is really massage of the feet, as another modality to help with pain. And again, there's intermediate data on massage techniques, can also help with mood, anxiety, as well as things like constipation and neuropathy. This is one of the largest randomized trials of massage technique in with patients with cancer. And you can see patients who received massage had much better mood and pain control as compared to just simple touch. Now, please remember that the massage you receive, if you have if you're a patient with cancer, you have to be cautious. Make sure to go to a massage therapist who has training on how to provide massage in a modified manner that's safe for patients. You have to make sure you might have to modify the level. So oftentimes we only use level 3 or maybe 4, but we usually don't use level 5 pressure for patients who have cancer, especially if they're undergoing treatment. You might need level 2 or 3. And there's other national guidelines from the American College of Physicians. You can see for back pain, they talk about acupuncture, mindfulness, stress reduction as having moderate level evidence. So other national organizations are recognizing there are integrative approaches which have good evidence to support their use for pain. Now let's talk about mind-body practices like yoga and meditation. There's actually a high level of evidence around stress and mood disturbance and intermediate for quality of life and sleep. Here you can see in this guideline for regarding anxiety, for the first time you're seeing H, which is high-level evidence for patients in active treatment and after treatment to help with anxiety, as well as intermediate levels for things like yoga. And here, similar for depression, there's very good data to support the use of mindfulness techniques or mind-body techniques to help with that, both during and after treatment. This is a really interesting study where they use a hypnosis technique during a biopsy procedure, and you can see that patients who were randomized to hypnosis, the kind of clear circles with the solid line at the bottom, both graphs had much lower pain scores and lower anxiety scores compared to placebo or a standard of care. Another thing you'll note is that the hypnosis arm ends earlier because they finish the procedure faster. Here's another randomized controlled trial of a mind-body technique, yoga in particular, for patients with cancer. And you can see that patients who were randomized to yoga had much better sleep quality. So they went to sleep faster and had better sleep quality overnight than those who did not practice that. So oftentimes I'll tell patients, why don't we try meditation at night rather than a pill? And lastly, this is published just recently, about 6 months ago, called the Match Trial. They compared mindfulness meditation versus Tai Chi, and they looked at their overall mood. And you can see that both patients randomized to Tai Chi and mindfulness actually had reductions in overall anxiety and stress, so their mood improved. And then compared to the dotted line, which is the waitlist control, so they were just monitored, had no intervention. So clear improvements over the time period with those who were practicing mind-body techniques. Lastly, music therapy has also been studied, and there's some data to support its use for stress, anxiety, mood, quality of life as well. This is a study for patients who were receiving a music therapy intervention during a biopsy procedure, during breast surgery, and you can see that those who received the music intervention had lower rates of anxiety. And this is a study in children who were getting a lumbar puncture. And you can see those who were randomized to music intervention had, again, lower pain and anxiety as compared to a control group. So no need to be using a medicine like Ativan to help you relax. We could use music or meditation to help you relax during their treatment. And lastly, we'll mention again lavender aromatherapy we talked about earlier. There's actually a compound called linalool, which is the active ingredient for relaxation. And there have been studies using this kind of technique for patients to help them relax during a bone marrow biopsy. And we're actually conducting a study currently, which we just finished, and we did see significant improvements for patients who just breathed in the lavender or linalool essential oil compared to a placebo, and it did help them relax and have less pain during the procedure. So we here have also done a similar study and shown the same benefits. So let's kind of summarize. Well, what's the level of evidence? So if you have pain, you could think about things like acupuncture, hypnosis, massage as ways to help manage those symptoms. The numbers indicate high level evidence is one, intermediate two, and three is low. For anxiety or depression, you can think about mindfulness techniques that have high level evidence along with acupuncture, tai chi, qigong, yoga, deep breathing techniques. Fatigue, exercise is the number one recommendation, but on top of that, you could think about acupressure, tai chi, qigong, ginseng have some data. Insomnia, as we just talked about. Melatonin is something that has been shown to be beneficial for sleep. For hot flashes, there's data on hypnosis and acupuncture and yoga. If you have neuropathy due to your treatments, acupuncture massage can be helpful. We talked about nausea with acupuncture and for dry mouth. And the NCCN guidelines, the National Comprehensive Cancer Network, actually include integrative therapies now. And you can see they include things like acupuncture for pain and nausea, hypnosis, MBSR is mindfulness-based stress reduction, and for dyspnea. This is just an example of one of those pages. You can see they have a whole page on integrative therapies for pain management. Lastly, I'm just going to talk about what we're doing here at City of Hope. 2 years ago, over 2 years ago now, we received a very generous gift from philanthropists Peggy and Andrew Cherng and the family to create a center for integrative oncology, which we established, the Cherng Family Center for Integrative Oncology, really a first of its kind national program. You see a picture of them there. And so we're really focused on innovative care delivery, a multidisciplinary approach that kind of combines together the best of Eastern and Western medicine. It's medicalized and evidence-based. We're doing research, as we talked about, that's patient-centered, that's practical, and we're really looking into the science of how these things work. And we want to be training the next generation of providers, as well as helping to provide education like this to the community and to patients at large. We talked about our model, and we have services in these different areas, which I'll talk about in particular, really hitting every dimension. And so we started in Orange County over 2 years ago, actually a little about 3 years ago, we started providing our consultation service, myself and Dr. Ann Reb, our nurse practitioner. We have a mind-body counselor, Dr. Frank Munoz. We have group programs like meditation, yoga, and qigong, which are being provided both in person and hybrid, televised online. We have an acupuncturist. We have Dr. Lucy Posback, nutrition counseling with Preeti Soni, exercise counseling with Art Rodriguez, and massage therapy with Christina Di Cristofano. We did have a music therapist. He just recently moved back home, so we're looking to hire another music therapist. And we've piloted a wellness program, which we plan to pilot again. And then we've also are providing services up in Duarte. I go to Duarte on Wednesdays and see patients. Again, we have the group programs. We have an acupuncturist, Dr. Wiley Huey, nurse practitioner, Dessa Huey. And actually, our massage therapist also recently moved, so we're hiring a new massage therapist. We talked about the music therapist as well. And in the near future, we'll be thinking about nutrition and exercise as well. So in summary, really think about integrative oncology as a spectrum of supportive care services that can really help optimize cancer care. The true integrative oncology needs to be evidence-based and personalized. And lastly, think about non-pharmacologic interventions like acupuncture, mind-body therapies, massage, music therapy that can help symptoms such as pain, anxiety, and sleep. I'll just end on this. The Society for Integrative Oncology, which I'm a member of, I'm the president-elect for the society. We have an annual conference, really highlights some of the best science that's happening around the world. It's an international conference, and so this year will be hosted by Henry Ford in Detroit. So if you're very interested in this topic, patients are welcome to join the conference. It'll be end of September, beginning of October there in Detroit. So feel free to explore and join the meeting if you're interested. So with that, I'll finish up and happy to take any questions from the audience. So thank you so much.
Thank you so much, Dr. Lee. We did receive a few questions in the Q&A, so I'll go ahead and get started with those. So first question, with there being so many diets to address cancer, some completely plant-based, others far from plant-based, but whole foods nonetheless, what explanations can be provided for why bodies with cancers can move toward remission with choices being all over the spectrum?
All right. So it sounds like this is a really question around diet. What's the right nutritional approach? Okay. This is a very common question I get in my own clinic, and I think online there is a wide variety of guidance you might see. I've had patients, there's something called Redwood diet. You just eat cottage cheese and flaxseed, to patients do all raw diet. You probably heard of ketogenic diet, which is essentially eating fat and protein all the time, no carbohydrates. There's even more recently about fasting diets. What I would say is we follow the evidence. And so if you look at the American Cancer Society and American Institute of Cancer Research guidelines, these organizations pull together experts from around the world to review the data. They really support a plant-based diet, Mediterranean-style diet, focuses on fruits and vegetables, and you can incorporate protein from, say, poultry and fish because they tend to be healthier sources. They recommend less red meat, and again, avoiding processed foods, as we talked about earlier. This has been shown to be a balanced, sustainable approach to cancer care. And actually, data indicates it reduces the risk of cancer, both in terms of primary reduction and secondary reduction. So reducing your risk after you've been diagnosed with cancer. All the other diets have not really been well studied. And so it's unclear about what impact they may have. And in fact, some of these diets can be quite challenging and really not sustainable and could be harmful. I mean, if you really think about, say, the ketogenic diet, it for most patients is not really going to be appropriate because it's very difficult if you do a true ketogenic diet. It puts a lot of stress on the body. Should you really be eating, protein and fat only? Atkins did die of a heart attack, and so I think there should be some caution around these approaches. So I would strongly recommend you work with your medical team, your cancer team, and work with a registered dietitian about an appropriate dietary approach that needs to be balanced. And that's really based on the literature and the science that exists today.
Perfect. Thank you so much. Another question, are all medicinal mushrooms safe to use during all stages of treatment, including day of? Have been told that they can strengthen the body and that certain ones can increase white and red blood cell counts.
Yes, so there has been research on the use of mushrooms. So and I would say here at City Hope, we actually have multiple groups, including my own research group is looking at mushroom extracts. So mushroom extracts in particular have been used successfully in Asia. There have been prospective randomized trials in Japan showing potential benefit, and it's thought to modulate the immune system. What I would say is that if you look at most of the studies, they tend not to use mushroom extracts during active treatment. And so I think that'd be one because you might have drug-drug interactions. And then could there be populations for which a mushroom extract could be potentially harmful? Well, if you think about mushrooms being immune stimulatory, patients who have a blood cancer, leukemia, lymphoma, myeloma, is it possible that the mushrooms might stimulate these cancer cells? Because these leukemia and lymphoma really are immune cells, right, that have become cancerous. So I am very cautious and generally almost never recommend mushrooms to patients with blood cancers because of the risk that it might stimulate their cancer that they have. And then for patients who have solid cancers, the best data is probably around colon cancer and gastric cancer where you have randomized trials. But again, you need to talk to your medical team and really look at it carefully. And when someone put in about reishi mushrooms, really we're looking for prospective placebo-controlled randomized trials in large numbers. And very few mushrooms actually have high quality research demonstrating their safety and efficacy. And so I think you have to, think about very, very carefully and be very cautious because one last thing you want to do is take something that might interfere with your chemotherapy. Could it interfere if you're on immunotherapy? There could be an interaction with your immunotherapy. So I would be very cautious and can be appropriate in certain populations. But again, I would talk to your medical team about that. But again, I think you really want to use something that has been well studied, right? Is there a prospective randomized controlled trial in patients? I say that people would like, oh, of course it has to be in patients. You'd be surprised how many times I'll have a patient say to me, oh, there's been a research study. And when I look it up, it's in mice. And I say, well, that's great for mice, but unfortunately, most of my patients are not mice. And so what does it really do in a patient and a human who has cancer on active treatment? That's a very different question. And so you have to rely on the clinical trials.
Perfect. Thank you so much. Another question, what modalities help to heal/reduce neuropathy in the feet post chemo?
Right. So this is a post-chemotherapy. I know there are some strategies people have looked at with some benefit is such as things like cold, the cold caps, and they're also using kind of equivalent on your hands and feet, kind of gloves and socks that you can wear. So there's some data that can reduce the risk of developing neuropathy. It's not 100%, but might reduce the risk. Once you've developed neuropathy, say you have chronic chemotherapy-induced neuropathy, there is some data that acupuncture can be helpful if you're looking for an integrative approach. So acupuncture probably has some of the best data. We have some randomized controlled trials. And there is we're doing actually a clinical trial, so we don't know for sure. We're actually have an active clinical trial for patients with chronic chemotherapy-induced peripheral neuropathy. We're actually looking at medical cannabis as an approach. So we have a placebo-controlled trial. So hopefully in a couple of years, I'll be able to give you an answer whether it's helpful or not.
Thank you. Um, and another question is, what are the greatest points of debate among those in the integrative cancer care community, and why is there disagreement on those?
Oh, that's a kind of a vague question. I would say there's a lot of areas of debate in the field. So, I think ultimately, whatever the debate is, whether it's about diet or different herbs or supplements, it really comes down to high quality science. And that's the only way we're going to be able to answer these questions that exist. Because until there's a randomized controlled trial demonstrating both efficacy and safety, you won't really know what the risk-benefit ratio is. And unfortunately, I think there's a lot of marketing. I have a lot of patients who say, "Oh, I read this, or I went to this place, and they're recommending these 10 supplements." But the reality is probably 90% of those supplements have not had high quality human clinical trials in cancer to know whether or not it's safe and effective. And so I think you have to be very cautious about those kind of things. I can see in the chat there's something about, antioxidants. I mean, we used to think antioxidants were a good thing, but as I noted, like vitamin E is an antioxidant, beta carotene is an antioxidant. These things can actually promote cancer growth. And so right now we don't recommend antioxidants because there have been randomized controlled trials showing that it seems to promote development of cancer rather than prevent it. So many things that we used to think were safe when we tested them, they tended to be either more harmful or have no effect. And so I think that's why we just have to continue to support the research.
Thank you. And then, are you aware of research on a methionine or cysteine restricted diet? I'm probably reading that wrong.
Yeah. Well, I'm not aware. I mean, there's a lot of different diets being studied. So I think, again, I'm not familiar with that specific one. But again, we would want to look at the clinical trial data to really support, really provide a guidance on whether it's helpful or not and safe.
Thank you. And is there any evidence for anything we can use or take in preventing cancer recurrence other than diet and exercise?
Yeah, there are certain things that for certain populations that can be looked at. So, for, beyond say diet and exercise, which is the number one recommendation, right? So be physically fit, eat healthy, avoid all the risk factors. People are often surprised that alcohol is a risk factor for developing cancer, but it is, as smoking is, right? So, among those kind of environmental things you can do along with your lifestyle and eating healthy and exercising. In certain populations, women who might have a hereditary gene that increases their risk for breast cancer, there are medicines that can be prescribed to reduce that risk, right? And people are looking at other medicines to help to reduce the risk of patients who have high risk for, say, colon cancer. So I would really work with your medical team to figure out which medicines might be appropriate. From an integrative standpoint, there hasn't been any herb or supplement I'm aware that's been studied in a high quality, clinical trial to demonstrate reduction in, cancer development.
Thank you. And then regarding the keto diet, someone has heard that it's recommended for brain tumors, for brain tumors. What is your view of diets for brain tumors?
Yeah, so I'm not a brain cancer expert. There is some reasonable data out there about why the ketogenic might be helpful for patients with brain cancer. So I think that should be a discussion with your medical team. The ketogenic diet, a true ketogenic diet, is actually quite difficult to do, just from a practical standpoint. And it does put the body under a lot of stress. So if you do pursue something like that, you probably need to be monitored. People probably may not realize the ketogenic diet was first developed decades ago to help with kids with uncontrollable seizures. Actually, that's how the ketogenic diet came about. And kids who have uncontrolled seizures, the ketogenic diet can be helpful in reducing these seizures, but it does lead to developmental growth problems because it's not a healthy, balanced diet. And these kids have to be monitored very carefully because it's really, difficult diet and stressful diet on the body. So that should give you a sense that it's a challenging diet and needs to be done under medical guidance and supervision. But I think if you have brain cancer, it's something worth talking to your medical team about.
And someone else said ivermectin and fenbendazole are very,
Barbendazole,
very, very
very
popular
popular. Yeah.
off-label drugs utilized by many cancer patients. What are your recommendations?
Well, I probably sound like a broken record, but first thing I'm going to say is, what is the data? So if you look at the data and randomized controlled trials of ivermectin and febendazole, I think there are almost no published studies of this for cancer treatment. So one, there's very little data that exists. I think people are studying it, so I think there are ongoing clinical trials or people are looking at it in the laboratory, but I think it's a bit premature to say that these kinds of interventions have value. I will tell you my own practice, I've had patients try it. I have had yet a single patient who have tried this as an anti-cancer treatment come back in better shape. All the patients I've seen pursue this, unfortunately, have had disease progression. And so I think there's unfortunately a lot of misinformation and marketing around this as a cure for cancer, and a lot of patients have suffered, unfortunately, from this misguided lack of scientific data around it. So I would suggest extreme caution and recommend talking to your team about it. But until there is more scientific proof that this is helpful, I'm concerned it may be more of a myth than actual science. I will tell you, though, every 5 years there's some kind of new thing that everyone asks about. So, 5 years ago it was really ketogenic diet, but that's kind of gone out of favor just because, the science isn't there and it's not curing anybody. 10 years ago it was probably metformin. I used to get asked about metformin all the time. Then they did a metformin study. Phase 3 randomized trial of metformin in breast cancer showed no benefit in overall survival. So most people have stopped that. IV vitamin C 5 years ago, everyone was asking me vitamin C. I don't know if people know there was a phase 3 randomized controlled trial of IV vitamin C in colon cancer. It showed no benefit, no improvement in quality of life, and no benefit in survival. There's also another study published by John Hopkins on IV vitamin C. It showed also no benefit in survival and actually showed that there might have been a slight increase in deaths in the vitamin C arm. So I think, to me, vitamin C is one of those things that needs to be studied, and there's still yet to be a large randomized trial showing survival. So I think we just need more studies. Might it help certain types of cancers? Maybe, but again, there's been 2 studies, one in colon cancer, one in prostate cancer, showing no benefit and potential harm. So again, what you'll see right now is IV vitamin C is kind of dropping down in popularity. Again, because these studies are coming out, is not really curing people. So, again, I don't know what it'll be in 5 years, but I'm sure there'll be another alternative therapy that'll come up in 5 years. And, so ivermectin, febendazole, I think will fall out of favor within a couple of years.
And then there was another question regarding insurance, but do you know if insurance covers the cost of integrative oncology?
Yeah, everyone's insurance is variable. So I would always check with your insurance company. Good question. There's also data. Right now, Medicare does cover acupuncture for low back pain. So that is something that is covered. So I'm hopeful that in the future, more and more insurance companies will be covering things like acupuncture and massage. I would say acupuncture has some coverage, massage a little bit less. Mind-body medicine, although that has very good data, is generally not covered right now.
Thank you. And someone asked, how can sleep be impacted by chemo and radiation? And a follow-up question, what can one reasonably expect to occur and what can one do other than medications, particularly if the lack of quality and the quantity and quality of sleep feels distressful?
Well, what I would recommend for patients, who are having trouble with sleep is, as we talked about, there's been a randomized trial of, say, yoga meditation. And so I always recommend some kind of relaxation technique, and for patients to learn that. There are free apps like Headspace and Calm apps that have meditation, guided meditation specifically for sleep. We might want to attend a group class. You can also, as we talked about, lavender aromatherapy has shown to help people relax. So you could try that. You could try some melatonin. There is a little bit of data on CBD alone being helpful for sleep. So these are some more natural approaches you could try to help with sleep. If you may, if it's really been if chronic issue, you may need to do a sleep study. There might be underlying issues like sleep apnea that might be also contributing to a poor sleep. So work with your medical teams. Again, you could think about some of these more natural approaches that have some data.
Great. And then one other question. Can you share some examples of how more holistic and natural cancer treatments and integrative approaches are more or even less useful based on the type of the cancer, and which organs seem to be more or less responsive to natural approaches offered in integrative care?
Well, I mean, most of the data to date is not cancer specific, right? Although there is some data that certain cancers might be more sensitive to things like diet and exercise. Many of the things that we're recommending are really not geared toward the cancer itself, but really geared toward, your quality of life and symptoms. So it's really not, whether you have stomach cancer or brain cancer or lung cancer, I think that acupuncture for pain would help all of them. And so think about some of those guidelines. The SIO ASCO guidelines are widely available. And so you can look at it and see there's one on pain, there's one on anxiety, depression, there's one on fatigue. And I think I would look at those guidelines and then talk to your medical team about, hey, if I have a lot of fatigue, hey, is it okay if I try a Tai Chi Qigong class? Is it okay if I enrolled in an exercise class? Can I try some ginseng tea? Would that be okay? So I think you want to explore incorporating those into your overall treatment plan.
And then what are your thoughts on immunotherapy support with probiotics and a high fiber diet?
Yes, another, the microbiome or the bacteria in your gut is a hot area of research. What I would say to date, there isn't compelling data right now, although people are doing clinical trials for people to take a probiotic in particular. Now, there is data that a high fiber diet, which is more like a prebiotic, supports a healthy microbiome. But there is some researchers have found that when you take a probiotic, you make your microbiome more narrow. And a narrow microbiome is thought to be less healthy. You want a very broad spectrum, healthy microbiome. And so the best way to do that is through your diet rather than a pill. Yeah. And think about probiotics you can get through your diet. So like Greek yogurt, kombucha tea, sauerkraut, kimchi, miso. There's a lot of fermented foods you can incorporate into your diet, and that would be a healthier way to get probiotics rather than a pill.
Thank you. And a follow-up question on that. What about taking a probiotic before and after each chemo session?
I would say that there's no data to support that to date. I think it should be studied, but right now we don't have any data to support that. And so probably more important than taking a probiotic, as I mentioned, is really what is your diet like? I think too many times I've had patients who ignore the importance of a healthy diet, high in fiber, getting probiotics through foods rather than a pill.
Thank you. And someone is asking, how do you find phase 3 clinical trials related to incorporating integrative practices while on cancer treatment?
So you can go to the American Cancer Society website or the NCCIH website. You can also find, if you're kind of want to do your own searches, you can go to PubMed, which is the publicly available warehouse of scientific journal articles, and you can look for phase 3 randomized trial of acupuncture for pain or acupuncture for nausea. So you can search for these as well.
And another question, someone said, I feel like I hear about chemo, radiation, and surgery often, but rarely do I hear about immunotherapy. What is the range of side effects one can expect if they entertain immunotherapy alone or in combination with other conventional treatments?
I mean, and that's really a traditional oncology question. I would say that's kind of outside of the range of integrative oncology because immunotherapy relates to very specific drugs that have been developed to help boost the immune system. And so I would, defer that back to your medical team to discuss. But there are specific side effects that can occur depending what type of immunotherapy you might be pursuing or undergoing and in what context. But immunotherapy is a very important strategy these days. Again, it's another hot area, and there are multiple immunotherapy approaches that are being utilized for a wide variety of cancers, and it has been shown to be effective. So, not every cancer responds to immunotherapy, but many do. So, again, I would defer that back to your medical team.
And someone is asking, have there been any approaches to help lower or even potentially lower cancer stem cells that survive conventional treatments, which cause cancers to return?
Again, I think that's a hot area of research, and people are looking at cancer stem cells and how do you target them in particular. I'm not aware of any kind of integrative approaches that particularly target cancer stem cells, but I think it's being actively researched, but nothing for clinical practice.
And a question specifically about City of Hope, but in what ways, if any, is the Hope Center different than other integrative oncology wings around the country? Anything unique and specific to your facilities and or providers?
Well, I think a couple things for our practice in particular. We are focused on evidence-based approaches. We have the different therapies that we mentioned, from consultation to acupuncture, massage, music therapy, diet and exercise, mind-body medicine. And we are providing both individual as well as group programs so that it can be accessible, and we're actually growing. And then I don't know if everyone realizes the City of Hope is now a national system of cancer centers. So we have sites both one in Duarte, one in Orange County. We also have Chicago, Atlanta, Phoenix. So we're probably one of the first national integrative oncology programs, given our different areas of practice throughout the US. And we're actively engaged in research. We have multiple clinical trials that we're involved in. We probably have, in terms of research trials, both from basic science to clinical, we have over about 40 studies ongoing. Many of them are in the laboratory, some of them are translational, some of them are clinical, and we hope to be conducting more research trials. So stay tuned. Hopefully, we'll be publishing our studies and results soon.
Well, thank you so much, Dr. Lee, for being with us here today. We really appreciate you sharing all of your knowledge and just sharing your time to answer all of our questions. I do have one final closing slide that I
Mhm.
would like to share, but if you would like to learn more about Cancer Support Community Los Angeles, please visit our website at cancersupportla.org. And if you have any questions, please feel free to email us at info@cancersupportla.org. Dr. Lee has graciously agreed to share a copy of the slides, so if you would like a copy of those, please feel free to email us. We would also like to invite you to join us for our Mindful Self-Compassion class that meets weekly on Wednesdays from 5:15 to 6 p.m. It meets online, and you can register using that QR code on the screen. I want to thank Dr. Lee once again for sharing his time with us today, and thank you to the audience for being so engageful. We hope to see you all at a future webinar or workshop. Thank you, everyone.